Okay, so next let's talk about the actual implant itself. So first of all, what goes in your implant? So you have two different options here. Probably the most common in my practice right now is most girls will opt for a silicone implant. The other option is saline or salt water, and oftentimes this just comes down to a personal preference. Usually, silicone feels softer and it's less prone to rippling, which can be seen underneath the skin. So oftentimes a lot of patients, particularly thinner girls, will opt for this. Saline, on the other hand, tends to be a little cheaper, and in patients who are really scared because of the history of silicone, they may opt for this. So the big question is, what happens if my implant ruptures, or is it likely to rupture? So the official line on this is the implant industry and the quality of implants is improving constantly. So current implants are very safe. We know this, and we're not quite sure what the life expectancy on them is. But in general, once you have one breast augmentation surgery, you're going to sign up for at least, depending on your age, one more surgery, possibly further surgeries in the future. So this is something to be aware of. In general, the life expectancy of your implant is probably 10 to 20 years. But the two different types of implants behave very differently when they're ruptured. So saline implants, there's absolutely no question, because when it happens, the implant goes flat. So most of my patients who this happens to, the implant will go flat overnight. And it can be important to get to see your surgeon in a timely manner, because obviously a lot of girls will not want to walk around asymmetric. And the other thing is some of that pocket may sort of begin to shrink back in again. So it's good not to wait on that for too long, obviously. On the other hand, silicone, how it's designed right now to be a cohesive gel, when it ruptures, it usually stays in exactly the same spot. It doesn't go anywhere. So it's very difficult by just looking at the implant. Oftentimes there won't be many changes. And indeed, ultrasound can't oftentimes pick up whether or not the implant is ruptured. So you actually need an MRI. And in fact, when silicone implants were taken off the market initially, because of concerns for what happens when they rupture and concerns about whether or not ruptured silicone implants cause other diseases. When they were reintroduced back onto the market, there were two FDA warnings that went with this. Number one, they are not deemed suitable in girls under the age of 22. And number two, if you're getting silicone implants, you are technically signing up to a lifetime of checking on these implants. So this is done via MRI, and it's recommended that the patient have their first MRI 3 years after the implants are put in, and then every 2 years from then on, because this is oftentimes the only way you can tell whether or not the implant is ruptured. So that's the first point. The first big thing to decide is what goes in your implant. Then the next thing is to think about what's on the outside of the implant, or the implant shell. So two big choices here. One is smooth round and the other is textured. So why do we have a difference? The textured implants were designed to help with a problem called capsule contracture. This just basically means whenever you put a foreign body into your body will form a wall around it. That's not a problem in and of itself. However, for some unknown reason, in certain cases, that capsule or wall around the foreign body will begin to contract around the implant, and this is what's called a capsular contracture. And this is oftentimes where you see hardened breast implants. Once it progresses, they can become deformed, and in some cases, in the most extreme cases, even painful. So there's lots of different ways to treat this, and one of the ways it's thought to avoid this is by putting a textured coat on the outside of the implants. However, an interesting finding has come out in the past few years, and right now I don't use textured implants on my patients because of this. So There is a new disease which has just been picked up upon in the last few years, and it's called breast implant associated anaplastic large cell lymphoma. So, that mouthful just means there is a newly described type of lymphoma that only seems to happen in patients who've had breast implants. So, as scary as this sounds, a couple of things you should know. First of all, it's still extremely rare, number one, and number two, it's extremely treatable. Fatalities from this have been very, very small. So, um, however, most of these cases have been described in patients where that textured implant was used. So right now, as a personal choice, I don't use textured implants in general, and with modern techniques and the way we put implants in now, capsular contracture is pretty rare. So for that reason, I don't tend to use it. The next question is whether or not you're going to use a shaped implant, so a teardrop shaped implant, or a round implant. The vast majority of my patients do end up getting the round implant. And a couple of reasons for this is, first of all, when you put in the right size implant, what you're doing, like I said, is pushing forward the patient's natural tissue that's there already. And all you need in order to do that is a platform in order to create that natural breast. So the shape of the implant oftentimes isn't extremely important. That's the first thing. The second thing is the shaped implants are stiffer and require a much larger incision to put in. And then the last thing is, which is pretty scary, and it hasn't happened to me personally, but some of my colleagues have had it happened, is that when you put in a teardrop shaped implant, it's possible for that implant to flip. And that oftentimes can require a surgery to put it back in its right position, or as when it's happened in my colleague's case, switch it out to a round implant so it doesn't happen again. So those are your different options that I will discuss with you. There are lots of different tools we have in order to do these procedures, but again, when it comes to implants, what you want to know is one, what goes in your implant, so either saline, salt water, or silicone. Two, the shape of your implant, and three, what is the coating on the outside of your implant.